Hello, I'm Caroline West. Welcome to this program, Healthy Feeding, Healthy Baby, Eat for Health Infant Feeding Guidelines, coming to you on the Rural Health Channel. I'd like to acknowledge that this program is being broadcast from the land of the Wangal people of the Darug tribe, traditional custodians of the land and part of the wider Aboriginal nation commonly known as Aurora, and we acknowledge their elders past and present. Tonight, our wonderful panel will be exploring the fascinating field of baby and infant nutrition. Now, a healthy start to life with optimum feeding can make all the difference to how well our children thrive and, of course, develop. We'll be discussing the new NHMRC infant feeding guidelines, and we'll be looking at how new evidence is shaping our nutrition recommendations. Now, this is not just a program for health professionals. We'd love you all to join in the conversation by getting in touch with us and sending through your questions. So make a comment and our expert panel here will try and answer it for you. You can reach us via phone, text, email or even Twitter. The details are on your screen now. So send your emails to questions@rhef.com.au. Text us on 0408 408 932 or phone us on 1800 817 268 or tweet by using #RHEF. Now let's go to our panel, and I'd like to introduce you first to Joanna McMillan, Dr. Joanna McMillan, and she's an accredited practicing dietitian and recognised well-known face on media, registered nutritionist. So welcome, Joanna, and thanks for being here. Dr. Megan Elliott-Rudder is a general practitioner, obstetrician from Wagga Wagga, New South Wales. So thank you for being here. Monica Hogan is a lactation consultant and midwifery educator from the ACT. So thank you also. Natasha Murray is an accredited practicing dietitian from Alice Springs, a wonderful part of the world in the Northern Territory. So it's fascinating. Perhaps I can go to you first, Joanna. You're a dietitian. Why is it that we need these guidelines? Why are they so important?
Well, I think the thing is, when you're a new parent particularly, you are bombarded by advice from all sorts of people. So from your friends, from your parents, from your grandparents, from your aunties. And unless, you know, and much of that advice might be conflicting. So what we need to do is be able to have a sound reason for why we have set specific guidelines. Now, it's important to point out these guidelines are not just plucked from thin air. These are experts who have looked at more than 50,000 scientific papers, and these are good quality papers that have looked at what give us the best health outcomes, both for the infant and for the mother. And that's where these guidelines have come from. So that then allows you to make sense of the good advice and sift it out from the bad advice that you might be getting from all other sources. And I think it's also important for health professionals to be singing the same song and know that we're all giving the best advice based on the best evidence.
And we're all dealing with patients here, and Megan, you've actually had the wonderful joy of delivering close to 200 babies, which is a wonderful achievement. How are these guidelines going to be useful to you?
Well, I think they're quite valuable in informing health professionals when we're talking with parents, pregnant women, grandparents, dads, talking about what's going to be important for the baby who's a gorgeous newborn but has so much ahead of them in terms of development, brain development, gut development, immune system development, and you know, we want our children to grow healthy and strong, to avoid risks like obesity and infection. And the guidelines are something that we can be well grounded with. They're good as a reference point for health professionals. And when I'm talking with parents, new parents, I'm often talking to them about eating, what they're eating, what their children are eating, and how important that is for their health.
So it's all really what you're saying about outcomes too, isn't it? Sort of getting to that point of really improving the outcome.
Well, absolutely. And I mean, as Joanna said, there's a huge amount of research behind these guidelines, and that research looks at what difference does it make. You know, what a child eats, is that going to make any difference? If a child is breastfed initially when they're born, or if the child doesn't get that opportunity to be breastfed, does it make a difference? And what about if they're only breastfed for a short time, or 6 months or 12 months? And we can see that the results do make a difference in terms of the rates of otitis media, childhood obesity, childhood even cancers, and particularly infections such as gastroenteritis and respiratory infections that can put them into hospital. So all these things are quite important for child health. And then, of course, giving birth is part of a woman's reproductive process, and so that reproductive process continues as she's breastfeeding, and that affects how her uterus responds in the next few weeks. It affects how her breasts respond over months, and that affects her risks of breast cancer, ovarian cancer. Also affects metabolism, you know, so bone metabolism is different for a woman who's breastfed.
A lot of information to get across there, and I guess, Monica, you're used to talking to new parents about a lot of this information out there about breastfeeding. In terms of the guidelines, what sort of messages are coming through loud and clear?
Well, the big recommendation is that breastfeeding is a very important topic in Australia, and so the recommendations are that mothers, if they can breastfeed for as long as they want to, but we would like them to try and exclusively breastfeed for 6 months and then continue on through the time that they have solids. One of the key messages is the length of time that babies will feed is really up to mothers, and we know that it's beneficial to feed beyond the first year of life into the second year and for as long as the mother and baby would like to. So they're some of the key messages in terms of why we want to get good health outcomes for our mothers and babies. Another key message is the Baby Friendly Health Initiative, and there's a big push for that throughout Australia now, and that's one of the key recommendations that are coming out of the guidelines.
And Natasha, you work in the Northern Territory.
I do.
What's some of the interesting information that's coming back in terms of how groups in remote areas are travelling in terms of breastfeeding?
Well, women in our Indigenous remote communities, breastfeeding really isn't an issue. Most women breastfeed. It's only a very small percentage who don't. But one of our big concerns is actually with the delayed introduction of solids. So the new guidelines recommend at around 6 months of age, but in remote communities we are actually seeing children sometimes as old as 10, 11 months not being introduced solids until then. So the breastfeeding's fantastic in our communities.
But we're getting story, isn't it?
It is. It's fabulous. So we're working with mums and health workers to increase their knowledge about starting solids at the right ages so that these kids can have the best outcomes and the best health benefits.
And isn't that interesting though, Caroline, because that's quite a difference from some other cultures where what I see is a lot of mums actually trying to introduce solids much earlier than that 6 months, because either that they feel that's going to, and quite wrongly feel that that's going to help their baby sleep through the night, or that it's going to have some sort of benefits developmentally, or that they feel, oh well, my baby's more developed, it's more advanced because, you know, he or she is already having solids. And so I think that's the other thing that's important about these guidelines, is taking both of these, you know, extreme groups and everyone at various points along that spectrum and giving us some very clear guidelines that says no, there are no benefits from the evidence that introducing earlier than 6 months, and certainly that there's real problems by the delay until that much later time that you're seeing.
And how motivated are families when they come to see you at this point in the life cycle?
Well, that's what I love about dealing with new parents, is that it's a time of life that the family are highly motivated to make changes, not just because of the new baby in the house. I'm sure that you must see the same thing, Monica, that it's also a chance for the family to start improving the mums often start thinking about how am I eating and how should I be eating. Of course, they're also thinking about getting their body back and recovering from the pregnancy. But yeah, it's great to see that kind of level of motivation, and I'm sure that we all agree that mothers always want to do the absolute best for their babies.
Yeah,
absolutely.
And support and guidance can certainly come from lots of different channels, from your GP, a nurse, a health professional, and that's incredibly helpful. But I also guess that there's a lot of support that comes from trading experiences with other mothers and parents. So let's hear now from a group of mothers about their breastfeeding experiences in our short film, Breastfeeding Matters.
Hello Emily, my name's Penny. I'm a midwife here and lactation consultant, and I've come to talk to you and congratulate you on your baby Lincoln's birth.
Thank you.
You've had your first breastfeed?
Yes, we've had 2 today.
That's good. And was that comfortable?
Yeah,
That's good. It's important that breastfeeding is important to you because it's the safest and healthiest way for babies to feed.
I breastfed Xavier for 19 months and Lydia's 7.5 months at the moment, and I'll probably keep breastfeeding her for about the same time, about 19 months. I found breastfeeding really convenient and easy. I've been lucky. I've always had lots and lots of milk, so I've had lots of supply and never needed to worry about whether my children are hungry or not. It's really cheap. I don't have to pay for anything, and I guess it's also really healthy. I have been really lucky to have both my son and daughter are both really well children. They don't seem to get sick much, and I don't know how much breastfeeding's contributed to that, or it's meant to contribute to it.
Well, from everything that I've read and seen and learnt and things, it helps children with their development and helps with their immune systems and all that sort of thing. So I, with both my children, tried for as long as I could to breastfeed, but it doesn't always go for as long as you want, but that's alright.
My 2-year-old I breastfed for 5 months because my supply dried up, and this one is 4 months and I'm still feeding her, and I'll feed her for as long as I can or as long as she wants it.
I certainly know it. In my case, I breastfed my 3 children, and when you've got someone who's having issues, you can encourage, and I guess you can use examples from your own life. We have a very chatty group, and so you can talk about issues, whether it's having troubles with breastfeeding or how many feeds overnight, and because we have quite a large group, you can get, I guess, a range of experience. Some people were very good breastfeeders, some had real trouble, some ended up having to go to bottles. But because we've got the breadth of experience, you know, a lot of people have had the same, they've had the troubles you have, and so you can encourage, this is how I got through it, through sharing your own stories.
We've actually got a family-owned business, so I'm lucky enough that if I get a day teaching, because I'm a PE teacher, my husband can stay at home, so that's really handy, and we've also got all the grandparents here, which makes it a lot easier just for those extra hours that you need babysitting, but otherwise we haven't really faced any barriers at this stage.
I was quite nervous when I was going back to work with Xavier when he was a baby about how he was going to cope with me dropping a feed at lunchtime, because I would feed him at lunchtime, and it was amazing. He just didn't seem to notice, so all that anxiety I had prior to going to work was all really for nothing. And I'm starting to think about going back to work with Lydia, so I guess one thing I need to decide is whether she'll have enough nutrition to just not have a breastfeed at lunchtime, or whether she'll need some kind of a supplement. And I'm kind of thinking that she'll probably decide for us. You know, we might try a few things, and whatever she seems happiest with, we'll use.
Breastfeeding for me was such a wonderful experience, to be able to have the goods on hand at all times. I was thankful to not even have to express. I didn't have any issues, and so I was always with my babies. I was never further away from them for more than 3 hours, and it was a bonding experience, and I knew that I had the healthiness in my own body to give them the nutrients they need, as well as the antibodies they needed. I was unfortunate to get a gastroenteritis virus when I was sick with one of them, and I spoke to my midwife, and she was like, keep breastfeeding, because the antibodies in you while you are sick are going to help the baby avoid the sickness themselves.
So I guess that's another option I've got, to express perhaps while I'm at work, or I could even leave at lunchtime. I'm lucky her daycare will be reasonably close to work, so I could actually just take an extended lunch break and go breastfeed her. So that's another option. I feel lucky that I've got lots of options, and I'm pretty confident that something is going to work, and it's not going to be too hard when we get to that point in time.
That was a wonderful clip, wasn't it?
Yeah.
Monica, what did you think watching that clip?
Well, I thought it was fabulous seeing you know, all the mothers together, and I loved hearing the different comments that the mothers made about, talking about ideas and helping problem solve together as mothers, and that is just so important to the support element of being a new parent. So I love that. I love hearing the different stories that the mothers would tell. I think that was great, and I love the lady's term of having the goods on hand. I thought that was terrific.
And it was wonderful. She was so enthusiastic, wasn't she?
She was, yeah.
Yeah, it was wonderful
great
to see that.
And she made a really good point that I think can translate into the childcare arena, is that, our bodies are amazing. They can just do amazing things when we're breastfeeding, and we can produce antibodies to help protect our babies, just as she described with the gastroenteritis situation. And that's something that can be carried out to all childcare areas, so that if mothers spend a little bit of time with their babies in the setting that their child will be in when they start to leave them, if they continue breastfeeding through that time, it will help them to pass on those antibodies to their babies. So it's very protective in that element as well.
So Megan, in your work, how do you actually encourage women to continue breastfeeding? What sort of pitch do you use, if you like?
Yeah, that's a good question. Certainly when a woman's breastfeeding, she's got a lot of things on her mind. She's thinking probably at some time, most days, will I continue or won't I? And there can be various reasons why women decide, no, they're not going to continue at the moment.
Because it's interesting, isn't it? About 96% of babies start out breastfed, which is fantastic, but by the time we get to sort of 6 months, it's hard to get exact figures, but it seems to have dropped off to maybe 50% are breastfed or partly breastfed.
Yeah, that's exactly right. And so what we're seeing is that a lot of women start off breastfeeding but then have difficulty continuing, and some of that can be because they don't come across people with sufficient information. So, they might come to see a health professional and say, I'm concerned, I feel that my milk's drying up, or I don't have enough milk. And that health professional may or may not say to them, well, did you know you can actually adjust how much milk you're producing? If you can fit in an extra feed, or give the baby another feed 20 minutes after you've finished, maybe change a nappy, come back, have both sides again, that will increase your milk production. So you can actually adapt what you're doing to suit your baby's needs. And that sort of information often isn't getting out there.
Because that's one of the misconceptions, isn't it, about supply and demand, and perhaps mothers feeling as though they're not able to meet their child's nutritional requirements and therefore topping up with a different sort of feed. Natasha, do you have experience in that regard, in terms of the sorts of information that you give out to young mothers?
Yeah, so there is often that thought that, especially around the 4-month mark, that, my baby's getting fussier, they're feeding more often than normal, they're starting to not sleep through the night anymore. So there is that thought that my milk is drying up. But exactly as Megan said, there's the whole supply-demand thing, and kids tend to go through a growth spurt at around that time as well. So they do need that bit of extra nutrition, and breast milk supplies everything. It's the perfect food. So it supplies everything. Or if you're living in the hotter areas of Australia and that happens to coincide with the wet season or the temperatures rising, they just need more water as well, and breast milk can supply that too.
So I guess coming back to the dietary guidelines, there's information in the dietary guidelines to help address women who are concerned about their milk supply. There's information in the dietary guidelines to help address women who are finding that feeding's painful for them, which is often a reason why women will stop in the early weeks.
Yeah, is that quite a barrier, Monica, in terms of, nipple health and so forth?
Well, certainly. Pain, if women are experiencing pain, it can be a very big barrier, and it can make them stop much earlier than they would really like to. So if we, as health professionals, if we have access to good quality information, which we hear that the infant guidelines are, extremely well researched, we know that as health professionals we can provide the right sort of information to help mothers if they come in with common sorts of problems, and pain and trauma to the nipples are a very common problem and a reason why women will either delay or stop feeding in the early weeks.
And there are some other factors too, aren't there, that perhaps promote breastfeeding from those first moments that a baby arrives? For example, skin on skin. Tell us about that.
Definitely. So I mentioned earlier about the Baby Friendly Health Initiative, and one of the key points from the Baby Friendly Health Initiative are that babies are placed on mothers' tummies, skin to skin, as soon as they're born. And by doing that, we're allowing the baby to adapt to their new environment, which is their mother on the outside. So they've come from the mother environment inside and they're coming to the outside. This skin to skin is extremely beneficial. It regulates the baby's temperature, stabilises their heart rate. So after this big journey to the outside world, they're actually, the mum, just by having her baby skin to skin on her chest, is able to calm her baby and make sure her baby is in just the right place for the typical mammalian response, which is to have a little feed once they get there. So it's the right spot for babies to be placed, providing all is well with the baby, and we're getting better at doing that all across Australia. And that's a key point from this initiative, which is very well supported in the guidelines to help provide the best care for mums and babies as soon as they're born.
So that's one factor that can really make a difference. What about the use of dummies and so forth in newborns? What are the recommendations there?
Well, the recommendations are that when babies are breastfed, that if possible, dummies aren't used in the first month or so while babies are establishing their feeding. Mums are establishing their supply, and if they would like to use a dummy after that point, then they can do so, particularly putting babies back to sleep. So when their babies are on their back, that's one of the points in the guidelines that they can use. But I guess too, it's worth pointing out that not everybody needs to use a dummy, and it's really about choice, and some mothers would like to use that, and so it's not something that all babies need to have in their mouth.
It's a slippery slope, isn't it? And there are certain things we've got to be careful about with dummies too, don't we? I can see you nodding your head there, Natasha. What are some of the other things that need to be kept in mind?
One of the old wives' tales that I often hear is dipping the dummy into honey or sugar or something sweet to helping settle baby. And the guidelines clearly say this isn't appropriate. If you use a dummy, just use the dummy on its own. Don't dip it into anything extra.
Isn't there a botulism risk too for those under one?
Yeah. Honey is not recommended for kiddies under one because of that. It can cause a really nasty infection in little ones. Quite uncommon, but the possibility's there. So leave honey until after one.
And you're looking at dental health as well. You know, everything that you're doing with children in the first 12 months, you're looking at how to do this in the most safe way possible. So, you're avoiding having sweet things on their teeth for prolonged times. That's why if they're having bottles, they're not lying in bed with their bottles. It's looking at protecting the ears so that they're not lying back propped with a bottle. You're sitting them up and holding them so that you're reducing risks.
Yeah. And so I guess in terms of baby health, mother health, there are so many fantastic benefits to breastfeeding. How can we actually encourage women to keep going if they're feeling as though they're getting to that point where something else is getting in the way?
Yeah, well, I think what we also have to point out here is that it doesn't always work out, and we have to be, we were speaking earlier about the guilt or shame that can be on a woman if she can't or doesn't want to continue breastfeeding. And I think it's important that we do point out that although formula feeding is not as good, it doesn't offer some of those fantastic benefits of breastfeeding. It's really important that women are supported and not made to feel as if they've done the wrong thing, because in the modern context, I know for me when I was a new mum and I didn't have family around me, it was a difficult thing to continue to breastfeed past a certain point. So I think we do also have to support every mother, regardless of what decision she makes. And if we can encourage and support and make it as easy as possible to breastfeed, then that's fabulous. That's the route we should follow. But equally, formula feeding is nutritionally adequate. Those formulas have come on a huge amount in the last few years, and they are offering, very good nutritional support.
Are there particular guidelines around that in terms of formula feeding, in terms of what people need to think about, in terms of preparation, storage and so forth?
One of the big things is choosing the right formula for your baby. There are lots of different formulas out there, and also how you prepare it. So making sure, because there are different scoops in different tins as well, so making sure you use the scoop that comes with the tin that you've purchased, not to overfill it, not to underfill it, because then you're changing the way the formula's made. Making sure bottles are cleaned and sterilised properly, which for some people in some community groups is difficult. The sterilisation and the cleaning process of bottles is a problem, which can can lead to more cases of gastro and things like that. So looking at all of those aspects as well. And for some people, formula is quite expensive too. So in our remote communities, it can be very, very expensive.
But as you were saying, it was interesting that so many of the women living in remote communities are embracing breastfeeding.
Yes, yes, they do. And as we said, in some parts, though, that does lead to the delayed introduction of solids, and that can be due to not having good food access as well. So that's sort of the balancing act we play. If a mother decides not to breastfeed, that she has the right access to the formula in the community as well.
It's interesting what you're saying about the women in the remote communities all breastfeeding, and I guess that comes down to looking at the society around you, doesn't it, and what sort of support there is for women in the choices that they're making. You know, I think sometimes we look at it as though we're saying a breast or bottle, it's the woman's choice, she makes a choice, but in reality often she can't make that choice. And I think we need to look at ways of supporting her around that. And you know, sometimes it's practical things like paid maternity leave or looking at access to childcare near her workplace, because those might be barriers that are just too difficult for her. And then sometimes it's whether or not her partner gives her adequate support. Are they there for her? Are they changing the nappy? Are they saying, honey, you're doing a great job, I'm proud of you? And then sometimes it's just personal factors. I mean, for some women, as one dad put it, you know, it's been quite a personal thing, her breasts, and now they're out there being kitchen utensils. You know, so...
kitchen utensils, that's a new one, isn't it? But there's also that sort of, I guess that breastfeeding's come a long way in terms of community acceptance. So the majority of women will feel comfortable breastfeeding in a variety of circumstances.
Ooh,
but they're still
I
up against...
disagree with you on that
still,
one,
I was just
Karen.
about to go into the fact, though, that I said many women will feel comfortable, but there's also still... a bit of a backlash against women feeding in certain areas. You know, there have been cases that have been in the media about people asked to leave swimming pools and asked to leave cafes. And so obviously within the community there's still a mixed reception, which is, what does everyone sort of think of where we're at with that?
Well, I think that also affects the women's view of it. You know, a lot of women who have spoken to me will express the fact that they want their bodies back, or they feel uncomfortable. And this comes back to Megan's point about if there is peer support around a woman that makes it much easier for her to breastfeed. And these kind of stories that we hear about women being asked to leave cafes and leave swimming pools for breastfeeding in public do nothing to help that kind of support. And all it does is increase a woman's anxiety about where they're going to have to breastfeed, you know, about something that we keep very private suddenly is quite open and public, and so that makes many women feel very uncomfortable. And so we have to break, absolutely, yes, we have to break those sort of society rules or ideas about what breastfeeding is and when it's and where it's appropriate.
I think it's quite nice that we're able to talk about breastfeeding in public. I mean, if you look at one of the very common sources of support that women turn to, the Australian Breastfeeding Association. Previously they weren't allowed to call themselves breastfeeding because you couldn't put the word breastfeeding in the phone book, you know. And that's Australia in the 60s. That's why they were called nursing mothers.
Oh,
you know.
really? That's interesting.
Yes. So, I mean, in terms of that, I think the women who are told to leave these places, they need to be aware that they have the right, legally, they're protected under Australian anti-discrimination law, that they can feed their baby wherever they like. And in fact, if they feel what their baby needs is to be fed right now, well, you know, their prime responsibility is to look after their baby's needs. And for some women, they feel quite comfortable doing that wherever they are. Others need to know that there are restrooms, or, you know, my sister used to use something a bit like this, just a little shawl over her shoulder when she's feeding a baby, not because she had to, but because she felt a bit more comfortable with that. So.
Yeah, and you get some fabulous, you know, there's actually one that you can get that specifically sort of goes around your neck, so it's not going to fall down like the muslin can. So there are things out there, and clothing, you know, maternity clothing has got much better to make it easier to breastfeed. So I think all of these things are incredibly helpful.
Okay, so I guess we're really in a position now to encourage women to consider breastfeeding for as long as they can, or as long as they choose to. Absolutely. But really getting to that mark of, exclusively breastfed to 6 months?
That's right, yes.
And then beyond that?
And beyond that, feeding through the introduction of solids, which we've talked about as being around 6 months, and then beyond 12 months for as long as they want to.
And the important thing there to bring out is, though, that any breastfeeding is beneficial. So, you know, a lot of women, when they introduce a bottle, or they introduce one, you know, perhaps they're back at work and they're having difficulty expressing milk, so they give some formula. It seems this idea of, well, then you're on the slippery slope and breastfeeding is on the out.
Absolutely.
Yeah, and even if you're still doing a small amount of breastfeeding, it is still providing benefit to both you and your baby.
And I mean, the big reason why a lot of women will breastfeed is not for health reasons. That's kind of a bit, we talk about that because we're health professionals, but for a lot of women the reason they breastfeed is because they like that intimacy and closeness with their baby. You know, I mean, breastfeeding can be a pleasurable and fun thing for mums and bobs. Mums can feel quite a strong sense of satisfaction for what they've achieved, you know, and I mean, there's nothing wrong with that in terms of being part of family fun, and babies enjoy it too. Although I must say that if the baby attaches to the dad, she doesn't get much milk squirting around.
And when it comes to breastfeeding, I guess there are a lot of things that may influence a woman's decision to continue or not that sort of extend beyond that. And one of them might be regaining her pre-baby body back. Joanna, what do women want to know when it comes to that?
Well, we're in a whole world of myths here, because as health professionals, what we say is, well, you know, the extra fat that you laid down during pregnancy is actually to provide the energy that you then need to breastfeed. And I always often remind mums that, in fact, breastfeeding takes more energy than any stage of your pregnancy. So in theory, you know, while you're breastfeeding, you're using up those fat stores, and it should help you to get your weight back. But in real life, of course, not everybody follows that textbook example, and in fact some women may find that their appetite is increased dramatically while they're breastfeeding. They may find that they're sitting around a lot more, they're more sedentary because they're spending so much time feeding, and they may be snacking or having drinks that contain, so it's very easy to quickly meet those energy needs, and you might find that it does take you a bit longer to get your weight back than otherwise.
Yes, and as you're having the little snack, you suddenly notice the little person next to you is just following every mouthful. So that's an interesting thing, isn't it, Natasha? When to introduce the solids. We've talked about the 6 months as being the new guidelines.
So, and that is one of the signs, actually, Carolyn, is when baby is very interested in what everyone around them is eating, and some babies actually get quite upset when someone is eating in front of them. So the guidelines do say around 6 months, but their development is really important in knowing exactly when the right time is for that child. And every child is slightly different, so if you find that Bubby is reaching for food, that Bubby's following your food to the mouth and getting upset if you are eating in front of them, if you're finding they can sit with a little bit of support and they have good head control, and also the tongue reflex. If you pop a spoon or something on the lips of a little baby about 3 months old, you'll find their tongue goes out. It's called the tongue extrusion reflex. That's actually a reflex that drops off, and so when that reflex is gone, that's one sign that they're ready for solids, and that happens at around the 6 month mark as well. So watch your baby for their developmental signs, and they'll tell you when they're ready, and it might be at around 5.5 months, it might be a little bit later than 6 months, and then some kiddies actually skip the whole pureed part altogether and go straight to finger foods. So just watch your baby and let them lead you.
And Megan, are there any sort of hard and fast rules? I guess that we've grown up, many of us, with this era of we should pace the introduction of solids, and we need to introduce the food every X number of days. And what's the new thinking here?
Well, that is something that's changed with the new dietary guidelines, and what they're recommending now is it doesn't really matter what you start with. Start with something that suits you, start gradually, use a variety of different foods, and whatever's suiting you and your baby. I mean, your goal is going to be that eating is part of your social life, your family activity, and down the track your baby's going to be eating the same food as you off the table. So whatever's going to suit your family culturally is fine. You don't have to take things in different things at different times. The only caution on that is if there is a known allergy in your family, then whatever it is that's causing that known allergy might be better to wait before you introduce that food.
But in general, that's very interesting about the question of allergies too, because I guess that was part of the thinking behind a parent's decision to delay the exposure to certain foods, but we've actually got a statement from Professor Amanda Lee, who helped craft the guidelines, which is really interesting. And she says there have been some reports in the media about allergies and the suggestion that infants should be introduced to solids at an earlier age to stop allergies. We found no good quality evidence of that. The scientific evidence clearly showed that around 6 months of age is the optimum time to introduce solids for children. So that was Professor Amanda Lee. And that's really interesting, I think, because so often this decision about when to introduce solids was really driven by this concern about allergies. Now that even goes for the introduction of not whole nuts, but even nut-based products.
Yeah, so obviously you don't want to give whole nuts to a child because they are a choking risk. We recommend holding off of whole nuts until after 4 when kids can chew properly. But you can introduce, if there is no peanut allergy in your family, you can safely introduce peanut paste, start with a smooth peanut paste, or use peanut oil in your cooking right from an early age.
No, it's fantastic. So perhaps it would be a worthwhile point to cut to our next short film, because it's always interesting to see some babies and toddlers in action with their families, to see what's actually going on out there. So perhaps we could now go to the feeding journey.
Kira has a lot of fruit during the day, bananas, apples, she likes carrot, she has yogurt as well during the day, and Lucas has just started on his apple slices and things like that, and a bit of banana as well, but that's sort of all he's ready for.
With Ruby here, probably soonish, she's quite interested in us when we eat. You know, she watches me put my fork to my mouth quite intently, but yeah, we'll just try little bits at a time. I don't think, you know, she's not starving for it or anything, so I think a lot of people notice that their babies get quite hungry at 4 months and so, or 4 to 6 months, and they need that extra top up, but she's not quite there yet, so we'll just see how we go. She's quite content with just being breastfed at the moment.
We introduced solids at about 6 months. That was the guideline at that point in time, but he was totally disinterested. And so we kind of persisted in giving him snacks and food, and well, we tried to give him food for a long time, and he really wasn't interested in food until he was about 12 months old. And I kind of put that down to, I had a really good milk supply, and I think that he was never really hungry for anything much more. So it was hard not to be worried about that, and hard just to know that he was growing well when all these other babies around you are eating solids. But in his own time he started to eat, and you know, of course you're not going to have a 10-year-old that's not eating.
To be able to eat with Barry, I do have to think about what he wants to eat. So I tend to maybe chop the vegetables a little bit finer and cook it into the meals, and try to make it into something like corn fritters, something it's easy for him to pick up and eat by himself, rather than me feeding him and then we sit down and eat. So I tend to shop the basic things, for example like rice, potatoes, noodles. We do have a lot of Asian dishes in the house because of my background, and it's simple and easy to prepare too. Also, I always make sure in the fridge there's root vegetables and the green vegetables. We don't tend to eat too much red meat. It's a personal choice, and it's easier to digest fish and the chicken. That's what we find.
love corn, don't you? Wow.
In his bag, I always prepare a few things. One is like a yoga bar with grains, and he always likes that. Sultana, some fruit, and the one thing is popcorn. Popcorn only cooked in vegetable oils, not butter. Some homemade biscuits. It's always good.
Wow. Oh, mushroom. Beautiful vegetable.
Fantastic, wasn't it, seeing a family eating together?
It was,
terrific.
Yeah, and mum cooking. You know, we were sort of silently discussing a few little points there in terms of the nutritional factors that she maybe got wrong in there, but the positives were, you know, she was making food from scratch. It was a home cooked meal. The family were all eating the same thing. They were sat around the table with the little one in a high chair, and I think those were the real positives to bring out there. I do have to, the thing that was annoying me there was, I do want to clear up that red meat is not more difficult to digest than chicken and fish. Yeah. So I think that's important to point out. In fact, red meat is really important because iron is required, you know, from about 6 months of age. The other reason for introducing solids at that time is that your breast milk actually doesn't contain enough iron. Once they hit 6 months, they really need to get a dietary source other than breast milk. And so red meat actually is fantastic to give to babies at that age.
Mm-hmm. And what about the safety aspects of meal preparation in terms of what size food should we be giving small children?
Yeah, so for children, the little one's age in the film clip, he was about 2. So we want to think about choking risks in particular, because even kids in high chairs, they can get a bit bouncy and get a bit excited. So if you think about how big their little windpipes are, you don't want anything that's going to potentially block that if they're not chewing it properly. So things like popcorn and frankfurters with skins on them, whole nuts, grapes, best to leave them until after 4 years of age when the kids can chew properly. Now, grapes are a great convenience food, so a great way to get around it, chop them in half or into quarters.
And the same with baby tomatoes?
And then same with baby tomatoes, yeah, chop them in half or into quarters. Anything hard, like really supervise kids with apples and sometimes some of the hard pears as well. So make sure they're cut into thin slices as well. Or even vegetables are fantastic, just blanch them, chuck them in the microwave for a few seconds or blanch them on the stove in the steamer so they're soft and they're not going to cause that potential hazard for the littlies and maybe cause choking.
Like a carrot, for example.
Yeah.
Make sure it's a little softer.
Just a little bit soft.
Yeah, and I think that point about supervision is important too, especially if you've got other kids. I think if there's older children around too, sometimes that, you know, there's popcorn around for the older kids, and that's when it can get a little tricky for families. So, you know, I think it's worth pointing out when you've got your first baby, you know, you're a bit more diligent, right, standing over them. When you've got older toddlers or, you know, other kids you're trying to deal with too, it's very easy for no one to be supervising the baby.
They want to feed the kids, the little kids want to eat the same thing as the old kids. The old kids want to share their food with the little kids. So yeah, keeping an eye on the kiddies and encouraging kids to sit down to eat. It can be really tempting to say, okay, just run off and play and take this with you. But if you can, get them to sit down, whether they have their own little chair or whether you strap them into a high chair or whether they just sit down where they are on the ground, keeps them safe.
Yeah. Yes, and if you have any questions out there, don't forget to contact us. Now, we've actually had a question through. It was from Dot, and Dot wanted to know, why is it, and Megan, you might be able to answer this one, why is it that some paediatricians recommend that children start solid at 4 months? That's a little confusing, isn't it?
Well, it is very confusing, and I've certainly heard this story before. What we're finding is, like anybody else, who want to know what's new, we want to know the latest news, and certainly timing of introduction of solids with respect to allergies is a hot topic at the moment. It's being discussed at paediatrician conferences. There are papers coming out about it, but this is the point where we have to point out there's a difference between a theory and something that's actually been established under the evidence. So there are some ideas, but the evidence, as you said, is not supporting the change yet. And in fact, a lot of people are guided by risks of allergies according to the Australian Society of Clinical Immunologists and Allergists. And what they say is slightly different from the guidelines. They say 4 to 6 months. But what I say to mums is, see, even the allergists are saying 6 months is okay. It's within their bracket. So I think around 6 months is quite safe. We've got the evidence to support that at the moment.
Okay. So now we're at that wonderful stage of life where we've got our 6-month-old baby who's been tracking all of your food choices and watching what you're eating, and so now it's time to get creative and have a bit of fun with introducing foods for our toddlers. So perhaps, Joanna, could you take us through some of the foods that are your favourites for babies and toddlers?
We've brought along a few things with us today. Obviously not everything was suitable to bring along, so I want to just put the overarching umbrella, if you like, is the same as what it is for adults. In other words, eat wholesome, natural, minimally processed foods. You know, if I've got a bugbear in this area, it's that, you know, in the supermarket now, there's a whole section dedicated to baby and children food and nutrition and special foods and everything in special packets with characters and so on. And it's worth pointing out that there is actually no need for any of those foods, including the baby rice cereal. You know, if you think back to what did we do 100 or more years ago before any of these things were available, well, babies simply learned to eat what their parents were eating. Certainly we know that you shouldn't add salt to the food. There's no need to add extra sugar. You know, you don't want to get your children already have an innate likeness for sweetness. We don't need to encourage that any further, do we?
Exactly. Oh, they could have the whole fruit.
It's wholesome food. So include natural sugars. So we've got some lovely fruit here. So things like strawberries and little tangerines there, you know, bananas and apples and so on are all really great foods. And then of course veggies, you know, as Natasha was pointing out earlier, do blanch the carrots so that they're a bit softer. You know, little cubes of cheese. A lot of kids will want to start picking foods up and putting them into their mouths themselves. I brought along some quinoa because this was one of my favourites, and if you haven't heard of quinoa before, this is actually a pseudo grain, so it's closer to a seed in terms of its nutrition, but it cooks up like a grain. And what's interesting about quinoa was when I was first weaning my eldest son, I wanted a grain that was soft but gave it some texture. You know, he was moving on from that puree stage, and discovered quinoa was absolutely perfect, and my kids loved it, and then we started eating more of it as a family. So this is a really great option. You know, you can look beyond just your standard sort of, you know, pasta and rice to looking at grains like this that are great for the whole family to consume. Having lots of these little containers is great to get out and about so that you can pack some little snacks and, you know, have some fruit in this. And of course, remember the iron thing. So we don't have any meat here, but including meat and fish, and just either pureeing or mashing, putting it to the right consistency as the child moves from 6 to 12 months. So really by 12 months, they should be eating the family food, the family meals.
And joining together. And I guess you've got banana over here, and you've got some yogurt. So we've got to also focus on some inclusions with dairy. So we've got the cheese, some yogurt.
So banana is the perfect convenience food.
Well, it gets mashed in everybody's hair.
Exactly. Oh, it's awesome.
There's always an old banana, isn't there, in every mother's handbag.
There is.
Speaking of my own handbag here.
I can understand completely. So you can either take the whole banana in your handbag or chuck it into the backpack or wherever you go. If kids they might need a bit of help peeling it, but they can eat it themselves. You can cut it into chunks. The great thing is with a fork, you can mash it up to a consistency. So if you've got a bub who is moving on from the puree stage, you can make it a bit lumpy. You can actually make it a bit smoother. So you don't actually need to have a blender all the time. And then the great thing about yogurt is you don't need to have special kids yogurts. You can just use a plain yogurt and just mix it in. So just a plain yogurt, mix in a little bit of fruit. It can be banana, it can be strawberries, whatever you've got on hand. And you've got the bit of fruit, you've got the dairy as well, which is really important for bones and teeth and for protein too.
Now look, judging by the guidelines, a lot of our children are doing reasonably well with fruit and vegetables, compared to adults, that is. But there's often still room for improvement in terms of the consumption of vegetables. And certainly our next question reflects, you know, how we encourage our kids to eat more. And this is from a viewer. And they're wanting your thoughts on using tomato sauces on foods to help children eat their vegetables. Over to you, the panel. Monica, do you have a thought on this?
Well, I think it's always very difficult, obviously, if they're watching other people in the family putting tomato sauce on their food. So I think probably the best way to tackle that is to use that as a sometimes food. So it's not something you would want to be adding to every meal or to vegetables every day. you know, if you could possibly avoid it, I think that would be the best option.
If you do choose to use tomato sauce, there are lots of different options out there. So as Monica said, use it as a sometimes food. Trial your salt-reduced varieties, because tomato sauce is quite high in salt and sugar. And just use a little amount when you do use it as well. We're not saying you can't use it at all, but if you do choose to use it, just use a little amount. But the best way to get kids to eat their veggies is to keep offering the veggies and keep offering them in a variety of ways. Kids are naturally scared of new foods. So it harks back to our caveman days.
So we don't give up, you know.
No.
People often say, oh, my child doesn't eat that.
Yeah, but kids will sometimes have their own likes and dislikes. My youngest cannot stand capsicum. She will pull it out of anything, and I've given it to her heaps of times. But kids will need to see a new food up to 20 times before they'll try it, and they'll actually need to try that food sometimes up to a dozen times before they'll actually accept it. And that might just be smelling the food, having it on the plate in front of them. And one of the best things is seeing mum and dad or their carers, bigger brothers and sisters, other kids eating it. Peer pressure in a positive way is really good for getting kids to eat their vegetables.
I guess so that often you'll see tomato sauce not in the context of a vegetable, but in the context of pastries, pies. What are your thoughts on those sorts of foods for kids?
I think Joanna was about to say something on that.
Well, the only thing I was about to say was about, you know, putting the tomato sauce in the vegetables. I kind of think that's a little bit sad, because then we're just training our kids to like you know, it's an overwhelming flavour instead of allowing them to develop. You know, very young kids will eat vegetables. It's usually later you have a bit of a problem, and we have to bear in mind that young kids' taste buds are very alert. You know, they do taste slightly differently. So the bitterness of broccoli, for example, will taste far more bitter to a very young child than it will to us as adults. So I think we need to bear those things in mind. So sometimes, you know, mashing the broccoli up with carrot, the sweetness of the carrot will actually give it an overall acceptance of flavours, and your very young children will taste all those nuances of flavours between different vegetables. If you smother the whole thing in tomato sauce, you're really not allowing them to develop that flavour palette. When it comes to those other foods, like the sausages and the pies and so on, you know, these are also sometimes foods. Of course, you can get, you know, sausages are a great example where you can get some very good, nutritious sausages, and you can get some very awful, dreadful kind of sausages that really are sometimes foods. So, you know, certainly trying to encourage people to have more of the better quality ones, and limiting things like pies and so on that are going to go with a lot of tomato sauce.
I think you'll say there too, you know, a lot of parents aren't aware quite how much fat is in pies as well. And so it's something that you probably wouldn't be using pies and pastry every day with your child. It might be just occasionally, but, you know, it's like when your child's invited to a birthday party. There's junk food there.
It's a birthday party.
But it's a birthday party, you know, it's not something they're going to go to every day or even every fortnight.
And we've talked a bit about the sort of solid side of things. What about the drinks? I mean, when should we be moving? We've got some beautiful examples of sippy cups, and what should we be doing about fluids? You talked before, Megan, about water.
Yeah, so in terms of the cups, what you'll find is a child can use one of these cups probably from 6 to 9 months. You can get rid of bottles and just use these. In fact, some kids, particularly breastfed children, will find that they don't like a bottle and they'll just go directly onto a cup for other fluids. So, of course, they can go to the plain cups, but the parent looks at this one and goes, yeah, they're going to make a huge mess.
They're going to definitely make a mess with that one. That is inviting disaster.
That's why we have bibs, and that's why we have mops.
Yeah, so these ones are really quite popular with kids because they like the handle, and they're quite good for parents as well because the lid covers the spout and you don't get so much spill, which is quite good. And I've just brought along a bottle of water to remind me that we have to think about the mum's needs as well.
Because you get so thirsty, don't you, as a young mother?
Well, you do. And I mean, the reflex that drives the milk to flow, which is oxytocin, also drives your thirst. So you don't have to drink extra, but it's nice when you're out and about and you're thirsty to have something handy that you can drink. So, you know, you've got to look after yourself and your own needs as well.
And I guess that so often you see kids wandering around with juices or juice packs. I mean...
yeah, now that's a good point, and I must confess that I had one of my children with a little pop-top bottle with green cordial in it, and I was at the dentist, and the dentist just looked at the child and said, "Do you want me to throw that out for you?" Which kind of made the point to me, and the dietary guidelines point out that For children under the age of 12 months, the only fluid they need is water, which is interesting because a lot of parents feel they're doing the right thing by giving them juice.
Or they dilute it, thinking that somehow diluted it would be okay. But once again, you're dealing with the acidity and the erosion on teeth. And
the sugar.
And the high sugar
and the high sugar. And so dentists despair because so many of our children by the age of 5 have erosion on their teeth or a hole in their teeth, which is...
So, I mean, I'll often say to parents, you know, I understand that you're downtown, you're worried the kid won't have enough to drink, and we seem to actually focus a little too much on having water all the time everywhere, but, you know, if the child is thirsty, they will drink water. So they're not going to dehydrate.
And what about the whole area of organic foods? Because a lot of parents are very concerned about the nutrition they provide their kids. They want to know, should they be going for organic?
Well, it's really a personal choice. There's no strong evidence, no strong research to show that organic foods are any better nutritionally than your standard supermarket foods either. So if you do want to give your children organic foods for other reasons, by all means, it's a personal choice, but nutrition-wise, your standard apples and vegetables and everything else in the supermarket will give you the same value as your organic ones.
Well, I think the decision to go organic really is, I call it the health ladder, and it's sort of at that top tier. You know, we have to face facts that organic food is more expensive. It would be lovely to be able to give everybody organic food, but the bottom line is most Australian families are not going to be able to afford, and I would far rather make sure that Australian families are making, you know, meeting the guidelines for fruit and vegetable intake before they start worrying about should it be organic. The choice to go organic where there is evidence is about pesticides. Where there's not strong evidence is what, you know, we have very strict testing about the levels of pesticides that can be in our foods. So it's important to point out that we have a very safe food supply here in Australia, and it is that personal choice whether you want to go to the organics. You know, on that topic, I think it's worth bringing up, you know, because we've got a lot of plastic here, and everything that's, you know, made for young children, of course, is the convenience of plastic so they can't break, and it's safe that we're not, you know, dropping glass on the floor. But a lot of parents are concerned about the leaching of chemicals from plastics. So again, in Australia, we're quite lucky that most of the manufacturers of these products are fairly on the ball, and they have moved with making sure that most of these products are BPA free. But that might be, and that's one of the chemicals that we know can leach from plastics. So baby bottles, you know, most of the baby bottle companies have voluntarily taken BPA out and are using BPA plastic. So, you know, there's a lot of very positive things that manufacturers are doing here in this country.
So there's so much information, isn't there, to cover? We could certainly cover a lot more ground, but for those of you who are out there who'd like some more information, there are a number of terrific organisations who have a range of useful information and support on this topic. You could go to eatforhealth.gov.au. You could also go to the Pregnancy Helpline. You could go to Pregnancy, Birth and Baby on the 1800 882 436. There's also the National Breastfeeding Helpline for any parents or carers that would like more information, 1800 686 268. So some terrific resources out there. We're almost out of time, but what I'd like to do is just get your parting comments. So perhaps your take-home messages. Megan, what would you like to leave us with?
I think I'd like to leave us with the thought that mothers are really working very hard in difficult circumstances, and they need all the support they can get, and it will be ideal if they get good information from their health professionals and good support from those people who are close around them, because really confidence in parenting is so important.
Yeah. Natasha?
Be guided by your baby. So at around 6 months, be watching for those signs. Let your baby tell you when they're ready to start solids and when they're ready to move through the stages from going to puree to lumpia to your finger foods. And keep in mind, some kids will skip some of those stages. It's perfectly normal.
Yes, they will. They've got a mind of their own, those little people, haven't they? Jo, what would you like to leave us with?
Yeah, well, I think my take-home message is just very simple. Stick to wholesome natural foods, and then if you follow the family's healthy eating, forget about thinking about fancy bought baby and toddler foods, then you're going to be along the right lines and set that child up for life. You know, be adventurous, allow them to try all sorts of different foods.
Fantastic. Monica?
My take-home message is a follow-on from Megan's, that really our women and babies need every bit of support that they can get. So as health professionals, look at the guidelines and follow the information that's in them, because it will guide you to give the best advice and support.
Thank you. So thank you all for being with us tonight. Fantastic. We really appreciate it. And I hope you found this program on the infant feeding guidelines informative and useful. If you're interested in obtaining more information about the issues we've raised in the program, or you'd like to watch this program again, please visit the Rural Health Education Foundation website at rhef.com.au and click on the program page Healthy Feeding, Healthy Baby, Eat for Health, Infant Feeding Guidelines. If you're a health professional, don't forget to complete your CPD evaluation, very important, that form, which can be completed online. You'll receive a certificate of participation and, if eligible, your CPD points. Our thanks go to the Department of Health and Ageing for making this program possible, and a special thanks to you for taking the time to watch and for contributing to our discussion today. We'd really appreciate your feedback on the program, and your comments are incredibly important to us. So let us know that you watched the program by sending us an email or a text, and feel free to share your views. We'd love to hear them. I'm Caroline West. Goodbye, and join us again on the Rural Health Channel. This program, along with the Australian Dietary Guidelines program, which aired 2 weeks ago, will be packaged together with the actual guidelines on DVD. This DVD is available to order via the RHEF website. The Rural Health Channel broadcasts 24 hours a day. To see what other programs are showing for the rest of this week, jump onto the Foundation's website.